In this video, we will be covering heart rate, stroke volume, and cardiac output. First, we will see heart rate. The heart rate measures the number of times per minute that the heart contracts or beats. The pulse is often confused with the heart rate but refers instead to how many times per minute the arteries expand and contract in response to the pumping action of the heart. The pulse rate is exactly equal to the heartbeat, as the contractions of the heart causes the increases in blood pressure in the arteries that lead to a noticeable pulse. Taking the pulse is therefore a direct measure of heart rate. It is important to identify whether a person's heart rate sits within the normal range. If disease or injury weakens the heart, the organs will not receive enough blood to function normally. The heart rate gets progressively slower as a person moves through childhood toward adolescence. The normal resting heart rate for adults over the age of 10 years, including older adults, is between 60 to 100 beats per minute. The resting heart rate can vary within this normal range. It will increase in response to a variety of changes including exercise, body temperature, emotional triggers, and body position, such as for a short while after standing up quickly. A person's heart rate increases during exercise as the heart beats more to pump more blood and oxygen throughout the body. However, when training for fitness, it is important not to put too much strain on the heart. While the heart rate increases as a result of physical activity, an overall decrease in target heart rate is possible over time. This is because exercise strengthens the heart muscle. Due to this, the heart can pump a great volume of blood with each heartbeat, meaning it can beat less to get the necessary nutrients and oxygen to different parts of the body, making it more efficient. A healthy heart supplies the body with just the right amount of blood at the right rate for whatever the body is doing at that time. For example, being frightened or surprised automatically releases adrenaline, a hormone, to make the heart rate faster. This prepares the body to use more oxygen and energy to escape or confront potential danger. A resting heart rate refers to the number of times the heart beats per minute when at rest. However, age, activity levels, physical fitness, and other factors can affect a person's resting heart rate. While a normal heart rate does not guarantee that a person is free of health problems, it is a useful benchmark for identifying a range of health issues. The normal resting heart rates at different ages are: for newborns 100 to 205 beats per minute, infants under 1 year 100 to 108 beats per minute, from 1 to 2 years 98 to 140 beats per minute, for 3 to 5 years 80 to 120 beats per minute, from 6 to 7 years 75 to 118 beats per minute. Older children, teens and adults 60 to 100 beats per minute. These are the normal value of heart rate. The faster the heart rate, the less time the heart has for filling. At very fast rate, the cardiac output decreases. The normal sinus heart rate is 60 to 100 beats per minute. If the person is having sinus tachycardia, the heart rate will be more than 100 beats per minute. If the person is having sinus bradycardia, the heart rate will be less than 60 beats per minute. Factors affecting heart rate. The heart generates and maintains its own beat. Even though the nervous system doesn't initiate the heartbeat, it can alter the heart's rhythm and force of contractions. Specifically, the medulla in the brain detects changes in the body and sends messages to the sympathetic or parasympathetic nervous system, that is the division of autonomic nervous system, to raise or lower the heart rate. Stimulation of sympathetic nerve fibers releases the neurotransmitter norepinephrine, producing an increased heart rate, increased conduction speed through the AV node, increased atrial and ventricular contractility, and peripheral vasoconstriction. Stimulation occurs when a decrease in pressure is detected. Stimulation of the parasympathetic nerve fibers releases the neurotransmitter acetylcholine, which decreases the heart rate and lessens atrial and ventricular contractility and conductivity. Stimulation occurs when an increase in pressure is detected. Now we'll see the heart regulation, how to regulate the heart rate. Adjusting either the heart rate or the stroke volume can change the cardiac output. Anything that changes the heart rate is called a chronotropic factor. Positive factors increase the heart rate while the negative factors decrease the heart rate. The examples: chronotropic factors of the autonomic nervous system. As mentioned before, the nervous system does not initiate the heart contractions, but it can modify their frequency. Two centers located in the middle oblongata are the cardiac accelerator center and the cardiac inhibitory center. The cardiac accelerator center uses sympathetic neurons to stimulate the SA node and AV node to speed up the heart rate. The cardiac inhibitory center uses parasympathetic neurons of the vagus nerve to keep the SA node at 70 to 80 beats per minute. If the vagus nerve is severe, the SA node will typically set the pace at 100 beats per minute. There are three types of senses that feed information to the centers in the middle oblongata are the proprioceptors, baroceptors, and chemoceptors. First one is proprioceptors. Proprioception is the body's ability to sense its location, movements, and actions. Proprioceptors in the muscles and joints signal the cardiac centers of changes in physical activity. Nerve endings are located in the body's muscles, joints, and tendons. This allows the heart to increase output even before the muscles demand more blood flow. Baroreceptors or pressoreceptors are senses located in the carotid sinus, that is at the bifurcation of common carotid artery into external and internal carotid artery and in the aortic arc. They sense the blood pressure and relay the information to the brain so that a proper blood pressure can be maintained and detect changes in blood pressure. If blood pressure falls, the cardiac accelerator center stimulates the SA and AV nodes to increase the heart rate in an effort to restore blood pressure to homeostasis. If blood pressure falls, cardiac output drops. Therefore, the cardio-acceleratory center will stimulate the heart to beat faster and maintain cardiac output. Homeostasis is the self-regulating process by which biological systems maintain stability. Vice versa, if blood pressure suddenly increases, impulses will be sent to slow the heart rate, decreasing cardiac output and lowering blood pressure. Next is chemoreceptors. Chemoreceptors are located at the aortic arc, on carotid arteries, and in the medulla oblongata. A chemoreceptor detects changes in the normal environment, such as an increase in blood levels of carbon dioxide, that is hypercapnia, or a decrease in blood levels of oxygen, that is hypoxia, and a decrease in pH, and transmit that information to the central nervous system, which engages body responses to restore homeostasis. In response, the sympathetic nervous system increases heart rate and stroke volume so as to circulate more oxygen. A cluster of chemoreceptors near the fork of the carotid artery is called a carotid body. A similar cluster in the aorta is called an aortic body. Next, we will see chemical regulation of the heart. Certain chemicals influence the heart rate. Hypoxia, acidosis, and alkalosis all depress cardiac activity. The hormones such as epinephrine and norepinephrine from the adrenal gland increases the heart rate and contractility. Stress, physical activity, and excitement stimulate the adrenal gland to secrete more hormones, increasing the activity of the heart. thyroid hormones from the thyroid gland also increase the heart rate and contractility. These hormones affect cardiac muscle fibers in much the same way as norepinephrine by the sympathetic nervous system. They increase both heart rate and contractility. Then ions. The difference in the levels of cations, that is positive ions, between the intracellular and extracellular fluid are important for the production of action potentials in the nerve and muscle fibers. For example, the concentration of potassium, sodium and calcium have a large effect on cardiac function. Potassium ions have a negative chronotropic effect because they interfere with the repolarization of the myocardium. Increased potassium can slow the heart rate. Potassium ions are used as a part of lethal injection to stop a heart. An elevated level of sodium can decrease the heart rate and contractility. An increase in intracellular calcium levels increase heart rate and strengthens the heartbeat. On the other hand, excess sodium blocks calcium entry into the cells, thus decreasing the force of contraction, and excess potassium blocks action potential. Other factors that can affect heart rate include exercise, gender, body temperature, and age. The temperature affects several processes inside the body. When body temperature goes up, blood vessels dilate, which increases the heart rate in order to compensate for drop in blood pressure. On the other hand, a decrease in temperature can lower the heart rate, but only to some degree. If the temperature gets too low, the body will actually increase the heart rate while trying to warm up. Other factor is body fluid level. Dehydration decreases the amount of fluids in the blood, which causes constriction of coronary arteries. At the same time, the heart begins to beat faster in order to push the thicker blood through the blood vessels. Input to the cardiac center. The cardiac center in the medulla receives input from multiple sources to initiate changes in heart rate. These include receptors in the muscles, joints, arteries, and brain stem. For example, emotions and heart rate. Emotions such as fear, pain, grief, and anger all affect heart rate. This occurs because two almond-shaped areas of the brain called amygdalae are key players in the formation and storage of memories associated with emotion. It is thought that stimulation of the amygdalae, such as by emotion, causes it to send impulses to the autonomic nervous system. Anxiety, fear, and anger all cause the heart to beat faster. In contrast, grief slows the heart rate. It is also interesting that just the thought of doing something frightening, such as skydiving, can make your heart beat faster. Next is stroke volume. Stroke volume is the volume of blood pumped from each ventricle of the heart with each heartbeat. The stroke volume for each ventricle is generally equal, both being approximately 70 ml in a healthy 70 kg man. It is calculated using measurements of ventricular volumes from an echocardiogram by subtracting the volume of the blood in the ventricle at the end of a beat, that is end systolic volume, from the volume of blood just prior to the next beat, that is called the end diastolic volume. The cardiac output varies whenever the heart rate or the stroke volume are altered. Regulation of stroke volume. Stroke volume is effectively the difference between the EDV and the end systolic volume. The factors that affect stroke volume are preload, force of contraction, and afterload. EDV is the amount of blood in the ventricle at the end of relaxation, and ESV is the amount of blood in the ventricle at the end of systole. Now we will see the first factor, preload. The force the cardiac muscle fibers contract with during systole is affected by the amount of stretch they are subjected to. The greater the stretch, the greater the force. This is known as the Frank-Starling law. The stretch of the cardiac muscle is directly related to the amount of blood in the ventricle at the end of diastole, which is in turn dependent on the volume of blood returned to the heart via the veins, that is venous return. Thus, venous return is related to the force of contraction of the ventricles. Anything that affects the speed or volume of venous returns affects EDV and therefore force of contraction. So for instance, a slower heart rate allows for more time for blood to fill the ventricles, increasing the volume of blood in the ventricle at the end of diastole. Exercise increases venous return. As the increase in heart rate increases the pressure in the veins and the speed of venous return, and the effect of skeletal muscle activity skews the veins, pushing blood back to the heart, that is skeletal muscle pumps. Conversely, standing still means that the venous is reduced. Thus, the people who have to stand still are taught to discreetly contract and relax their feet to aid venous return and prevent fainting. Hormonal and nervous influences. The release of adrenaline or the excitation of the sympathetic nervous system leads to the contraction of the veins and squeezing of blood back to the heart. Very fast heart rates reduce the diastolic filling time, and thus there is less time for the ventricle to receive blood before systole starts. Certain heart arrhythmias stop the atria contracting effectively, and thus atrial systole is no longer effective at pushing the last bit of blood into the ventricles. A reduced blood volume, for instance, due to a hemorrhage, reduces venous return. Next is force of contraction. Though EDV is a major component of the force of contraction because of the Frank-Starling law, force of contraction can also be affected by other factors. The contractility of the heart can be affected by several factors. Hormones such as adrenaline, glucagon, and thyroxine all increase the force of contraction. Sympathetic nervous system activity increase the force of contraction through the action of noradrenaline. Contractility can be reduced by acidemia, excess hydrogen ions in the blood, and high potassium levels in the blood. Next is afterload. Afterload refers to the pressure in the arteria leading from the ventricle, aorta or pulmonary arteries that the ventricles must overcome in order to eject blood. In the normal adult, the pressure is 80 mmHg in the aorta and 8 mmHg in the pulmonary arteries. This difference in the pressure to be overcome is reflected in the relative thickness of the ventricular walls, with the left ventricular wall being thicker, more muscular than the right ventricle. In the average adult, aortic and pulmonary pressure is not an important factor in determining afterload as it is constant, but changes in anatomy and physiology such as hypertension or aortic wall disease can increase afterload. Increased afterload increases the amount of blood left in the ventricle after each systole, and thus also has an effect in increasing the preload, that is by increasing ventricular ESV and therefore increasing the pressure. Next is cardiac output. Cardiac output is the volume of blood ejected by the ventricles and is usually expressed in liters per minute. It is always closely matched to the body's demand for blood through the homeostatic control of the following four factors. They are heart rate, preload, afterload, and contractility. Heart rate. A faster heart rate gives more beats per minute, hence increased cardiac output. Preload. A bigger volume of blood creates more stretch and hence more force to eject a greater volume from the heart. Can increase the preload by fluids and vasopressor, and it can decrease by diuretics and vasodilation. Afterload. It is determined by the pressure and resistance within the arteries and systemic circulation. Hence, it reflects the force the heart has to push against. It can increase the afterload by vasoconstriction or decrease by vasodilation. Next is contractility. Contractility is the strength of the heart cell to shorten or contract. The mechanical properties of contracting cardiac muscle means that an increase in contractility leads to an increase in cardiac output. Calculating the cardiac output using the formula is cardiac output is equal to heart rate into stroke volume. Factors affecting cardiac output. Cardiac output is a term relating to the amount of blood the heart pumps out in a minute and is defined by cardiac output is equal to stroke volume into heart rate. Thus, the amount of blood the heart pumps out in a minute is made up of the amount of blood ejected from the ventricle in 1 beat times the heart rate in beats per minute. This gives a total volume. Thus, if SV is 70 ml and the heart rate is 75, then cardiac output is 70 into 75, that is 5250 ml, that is 5.25 litre per minute. So the factors affecting cardiac output is the factors regulating stroke volume and the factors regulating the heart rate. This is all about the heart rate, stroke volume and cardiac output.